Hi, my name is Jenny Lieberman, and I'm an occupational therapist in the Mount Sinai Hospital Rehabilitation Department. I work in the outpatient department, overseeing their wheelchair clinic, working with people who have complex wheelchair needs. Over the past few weeks, there have been a lot of changes in terms of the role of rehabilitation with the coronavirus. Several facilities have had their departments shut down temporarily. Mount Sinai's department, we had to close some of our rehabilitation beds in order to allow for coronavirus patients to be placed in the hospital. However, all of the therapists that were still remaining there, we all saw that our role began to change. Some of the therapists are now treating patients on the acute care facility end, and some of us are now working with the Precision Recovery Program. The Precision Recovery Program was started a while back to help work with patients who'd had strokes. The belief was that after somebody had had a stroke and was discharged home, they really needed increased monitoring to make sure that they stayed safe in their community. And at this point in time, it seemed only appropriate that for patients who had had the coronavirus or had had symptoms of the coronavirus, in order to keep them safe and healthy in the community, that we should actually work with them on a day-to-day basis. So Dr. Petrino and Dr. Kellner, who oversee the Precision Recovery Program, actually transitioned over for this component part. And so several of the therapists in the outpatient and the inpatient unit are now involved with this, and we're monitoring patients on a day-to-day basis. Now, the benefit of this is that we're allowed to work with the general population of people who either have symptoms or who have been diagnosed. This also carries over into working with the population of people with disabilities. There's a lot of similarities. You're talking about people who have had their high-risk patients, they're immunocompromised, patients with spinal cord injuries, they have pre-existing respiratory conditions, patients who've had strokes, they have pre-existing cardiovascular conditions. Some patients have hypertension, some of them have diabetes, and so this is really a high-risk population, just like our coronavirus patients. And so it was only a natural transition for the therapists to start to be part of this. The benefit of this, not just for our general population and for our population of people with disabilities, is that we can keep them safe in the community and we can monitor them and make sure that they don't have any recurrence of symptoms or have to go back into the hospital. On a day-to-day basis, we're monitoring symptoms based on patients' input on a screen and commenting on how they're feeling. There are some concerns for our population, especially our population of people with disabilities. And this is part of it. On top of being a high-risk population, this is a population that has people coming into their home on a daily basis. And so there's that added concern of social distancing and how do you have somebody come into your home and help assist you in taking care of you. And there are resources that are out there for this population. United Spinal has several resources for people specific to spinal cord injury. And Mount Sinai right now, there are resources that can provide you with telehealth services if you're experiencing moments of anxiety. And the Precision Recovery Program can help you if you develop some symptoms with the coronavirus. So there's a lot of support out there for people in the moment, and we're available for all of the population in New York City. Mount Sinai is there for you.